大麻の合法化による公衆衛生の影響ということで、クイーンズランド大学の名誉教授であられます、ウェイン・ホール先生から一つ目のお話をいただきます。
So today we are very honored here to have Emeritus Professor Wayne Hall with us as the first speaker. So Professor Wayne Hall is an Emeritus Professor at the National Center for Youth Substance Use Research here at the University of Queensland. And he was a visiting professor at the National Addiction Center at King's College London, the London School of Hygiene and Tropical Medicine, and the National Drug and Alcohol Research Center at the University of New South Wales. In 2016, Wayne was made a Fellow of the Academy of Health and Medical Sciences in Australia. Wayne has advised the World Health Organization on the health effects of cannabis use, the effectiveness of drug substitution treatment, the scientific quality of the Swiss heroin trials, the contribution of illicit drug use to the global burden of disease, and the ethical implications of genetic and neuroscience research on addiction. So I'm going to hand over the stage to Professor Wayne Hall. Thank you, Wayne.
Well, thank you again for the invitation to speak. What I'll talk today is about the impacts of cannabis legalization in North America. I'll focus on the US and Canada, largely because these two countries were the first to legalize cannabis for adult use in a legal market. And they have the longest series of data on the impacts of legalization. I won't discuss Uruguay, which was the first country to fully legalize cannabis, but under a much more restrictive model, which didn't legalize commercial production and sale as has Canada and the US. I'll be looking at how legal adult cannabis markets have been regulated in the US and Canada. I'll briefly summarize what we've learned about the impacts of cannabis legalization on cannabis markets, that is, what sorts of products are sold, what sorts of prices, what impact has legalization had on prevalence and use of cannabis amongst young people and young adults and older adults, and then look at the impact of legalization on harms arising from cannabis use, both physical health and mental health harms. And I'll say something briefly at the end about possible longer-term effects of cannabis, because as I'll argue, we're still in relatively early days with cannabis legalization in North America. The first thing to say about legalization is how it's been accomplished, and that has differed between the US and Canada. In the US, cannabis has been legalized by referenda, that is, popular votes in individual US states, where the citizens have voted to legalize adult use, and that's been passed. Initially via referendum, more recently state governments have legislated to legalize adult use. What's made that possible has been increasing support in the American population for legalizing cannabis or marijuana, as we can see here from survey data. In the early 1980s, there was only a minority of the US population that were in favor of illegal sales of cannabis. That increased slowly but steadily through the early 2000s, and it was around about 2012 when the first states, Colorado and Washington State, voted to legalize cannabis for adult use. And since then, we've seen an increase in support, so roughly 2/3 of Americans now support the legalization of marijuana for adult use. The arguments that seem to have persuaded people in the US to support legalization are these listed here, that cannabis use was common, particularly amongst young adults. It harmed comparatively few users, certainly compared to the harms arising from alcohol use or the harms caused by other illicit drug use, such as heroin, cocaine, and methamphetamine. The prohibition or criminalization of cannabis use, the argument was, caused more harms than cannabis use itself, in the form of giving young people who were arrested criminal records, and less commonly imprisonment. And these sorts of laws were often enforced in a discriminatory fashion against minority groups in the US, particularly African Americans and Latinos. And of course, the illegality created an illicit market for cannabis that was controlled by criminal networks. On the positive side, the argument for legalization is that legalizing and regulating a market would enable governments to better regulate contaminants in cannabis products, regulate the potency of these products, generate tax revenue for prevention, treatment, and other social goods, and make savings in terms of law enforcement and court costs by not enforcing criminal penalties against cannabis use. This is the current map of the US policies towards cannabis. It's a bit of a patchwork quilt, as people say. The light green are those states which have fully legalized adult use. The darker green have legalized medical use, often under very liberal regulations that make it easy for adults to access cannabis if they can find a medical practitioner who's prepared to recommend its use. And it's now a minority of US states, shown in the black, that still prohibit any use of cannabis. If we look at the proportion of the US population now living in states where cannabis use is legal, this is a recent graph from the American firm Statistica, indicating that roughly half of Americans now live in states where it's legal to use cannabis as an adult or for medical purposes. And this has happened since 2012, when the first states, Colorado and Washington, legalized cannabis. So how has cannabis been legalized, regulated since it's been legalized? Well, the most commonly used model has been alcohol, and that's for a number of fairly understandable reasons. People advocating for and campaigning for cannabis legalization have often used the slogan, "Regulate cannabis like alcohol," which of course makes the optimistic assumption that North America is successful in the way in which it regulates alcohol, when we know that it's a major cause of health-related harm at the population level. But it is a model that people are familiar with. It's a model that already exists, and so it can be readily adapted. And the existing regulatory bodies for alcohol can be used to implement legalization of cannabis and to raise tax revenue from the market. So I'll just give one example of the sorts of regulations. This is Washington State, one of the first to legalize. The regulations vary a bit from state to state, but in the US, adult legalization is only for adults over the age of 21, which is the same age for the legal purchase of alcohol in the US. And in Washington State, adults were only able to purchase 28.5 grams, which in the old terms more familiar to North Americans was roughly an ounce of herbal cannabis. They required separate licenses for people involved in the production of cannabis, that is, growing it, processing it for sale, and selling it at retail. They started off with fairly high taxes on the sale price, 37.5% at retail, and they added on a state tax. And they restricted medical marijuana use and did not allow any home cultivation. They also earmarked taxes, that is, set aside a proportion of the taxes from cannabis for the purposes of education and prevention, and interestingly enough, funding a cost-benefit analysis of the impacts of legalization policy. They also legislated to define cannabis-impaired driving by defining a level of THC in blood that, in combination with evidence of impairment, would produce a conviction for cannabis-impaired driving. They legalized by vote in 2012, but legal sales only began in July 2014. And as often happened in states that have legalized, there were initial problems in securing adequate supply to meet demand. Canada differed from the US in that legalization there was a policy that the current government of Jason Trudeau took to an election in 2015. They proposed to legalise cannabis for adult use, and they engaged in a fairly lengthy process of consultation and legalised the production and retail sales at the end of 2018, in October 2018, with a combination of federal licensing and regulation of cannabis producers, provincial regulation of retail sales, age of purchase, and so on. And they initially restricted the sale to herbal cannabis products. A year later, they allowed the sale of edible products and extracts, which I'll explain in a moment. Canada adopted a more public health-oriented approach than some US states. They decided to ban advertising of cannabis products. They required all cannabis products to be sold in plain packaging without branding, much like cigarettes are in Canada. And they set the legal age at 18 nationally, but the provinces could, if they wished, set a higher legal age, as Quebec did, setting a legal age of purchase at 21. Provincial monopolies are allowed, that is, the provincial or state governments are allowed to restrict the sale of these products to state-owned stores, as they do for alcohol in some cases. And the tax revenue from the sale of cannabis is shared between federal and provincial governments. There has been a proposal to tax cannabis products on their THC content, but that's still under discussion. Their medical cannabis program has continued for 5 years after legalisation, and it's currently being reviewed. So what have the short-term effects of legalisation been in the US? Well, obviously, if you're an adult who's interested in using cannabis and you're over the age of 21, you can now legally purchase cannabis without fear of arrest, and you can legally purchase regulated cannabis products that are labelled with THC content and so on. The obvious impact is if it's no longer a criminal offence, then there's a huge drop in arrests for cannabis, much less impact on imprisonment or incarceration, because very few people were imprisoned for cannabis use offences alone before cannabis was legalised. The other big impact has been a large fall in cannabis prices. As you'd expect with a legal market, there's more efficient production because it can be open on a larger scale. And as I'll show you in subsequent slides, there's been some very large drops in price in some of the early states to legalise cannabis. State tax revenue has been a little bit less than forecast, largely because the states decided to tax cannabis on the sales price, and as sales prices have fallen, so has tax revenue. And it hasn't been quite the windfall that advocates promised. In the majority of cases, it's producing about less than 3% of total state revenue. These are data on the early impacts of legalisation in California, Colorado, and Washington State, among the early states to legalise. This is a price per pound. As you can see, a fairly steep decline in prices overall. Particularly in Oregon, a very large drop, 50% or 60% drop in Oregon, 56% in Washington State. These price declines have continued since then. This is a different metric. This is the average price of a cannabis product in the US, and that's continued to decline into the early 2020s. Less marked decline in Canada than the US, at least to date. So it's much cheaper to purchase cannabis, and there's a much more diverse range of cannabis products available for sale, including products that are much more potent, that is, have a higher concentration of tetrahydrocannabinol or THC than the products that were sold on the illegal markets. So it's now legal to sell edibles, that is, products that can be consumed by mouth, such as candies, chocolates, cookies, and gummies. And there are cannabis-infused drinks or beers, fortified joints where herbal cannabis has THC added to it to boost THC levels to higher levels can be achieved by growing cannabis. And we've seen a growth in the sale of concentrates. These are the THC extracts from cannabis plants. And these have comprised only 40% of sales in Washington State in the early period of legalization. And this has been a contentious issue as to whether these sorts of products should be allowed to be sold. They are being sold, and there's a debate on whether there should be restrictions placed on the content of these products. So these are just some pictures or photographs of the sort of products. That's a gummy bear product that's sold, so people can chew on these to get their THC. This is an extract that people can vaporize or smoke. As you can see, there's 79% THC content and very low levels of cannabidiol or CBD. And we also see cannabis vapes being sold, so ways of vaporizing cannabis in the US. We've seen increases in those products in the US. There's been a bit of a decline in Canada in sales of herbal cannabis, the dried flower or leaf, the more traditional form, and a rise in the consumption of edibles. Not as big an increase in vapes and pens and cartridges, but there has been some growth in that market. So there's been a decline in more traditional methods of use and an increase in the use of less familiar routes of administration. So how have these products and the increased availability of cheaper, more potent products affected cannabis use, symptoms of cannabis dependence, and acute adverse health effects? If we look at the US, John Calkins has recently published an analysis of rates of cannabis use, prevalence of daily and near daily use, days of use per capita, past month prevalence and past year prevalence since around 2000, and which we can see there's been, in this period, those dotted lines indicate there were changes in the way surveys were done, so we have to be a little cautious in interpreting differences between those periods. But the survey methods have been reasonably consistent for the period from about 2000 onwards, and what we've seen there in the US has been a steep increase in the prevalence of daily and near daily use and days of use per capita. So more people are using cannabis more frequently, and more of them are using daily than was the case in the past. And the other big change that he's pointed to has been that the proportion of cannabis users who are daily users is now exceeded the proportion of alcohol consumers who are daily users in the US. So we've seen a big increase in regular or daily use of cannabis products since legalization in the US. And that's not too surprising if you make a product available, more readily available at a cheaper price, then you might expect to see more regular use amongst people who are using the drug before legalization. The situation in Canada is not as clear. There's been a much more modest increase there in cannabis use since legalization 2018. And it's not clear that we've seen any major difference in young people or young adults. And the same is true in daily and near daily use in Canada has been much more stable, much less clear increase in use than I've just shown you in the American data. Data in Ontario, which is of longer term surveys, here have suggested that there has been an increase in daily use since legalization. This is Ontario, the largest of the Canadian provinces, suggesting that there has been an increase in prevalence of daily use and cannabis-related problems since legalization in 2018. Less clear-cut increase here, and this is amongst younger adults, adolescents in Ontario, suggestion of an increase since legalization, but not as steep as we've seen in the US or amongst older Canadian adults. The question of concern here is if you see an increase in regular use of cannabis, you'd expect to see an increase in the prevalence of cannabis use disorders, that is cannabis dependence and abuse in the older language. Here the evidence is mixed. There's two major US surveys that are conducted annually. the National Household Study of Drug Use, Survey of Drug Use, and it tends to show a decline in the proportion of users who report symptoms of cannabis use disorders, whereas the National Epidemiological Survey of Alcohol-Related Conditions tends to suggest there's been an increase in the proportion of cannabis users who report symptoms of cannabis use disorders. I think other indicators of problems related to cannabis suggest that the NESARC data are probably more reliable, but there's still some uncertainty about that. In the case of Canada, national surveys, as I've already shown, only show a modest increase in daily use, although the surveys, as we'll see in a little later in Ontario, suggest that the rates of cannabis use disorders have increased in adults and adolescents. The data around treatment seeking is more mixed, and that's for one understandable reason. Fewer people are seeking treatment in the US, largely because fewer people are being legally coerced into treatment, as used to occur under criminal penalties. If people were arrested, they could often be sent to treatment as an alternative to being processed through the criminal justice system. That's no longer there. So fewer people are presenting to treatment. In Canada, we don't have any national data, but we do have indications of increased attendances of emergency departments for problems related to cannabis use disorders. If we look at short-term adverse health effects, the best evidence here, as we'll see, comes from Canada, and particularly the province of Ontario. US doesn't have good national data, and a lot of it's state-based, or in some cases only small numbers of hospitals. So I'll focus in what I have to say on time series studies of health service use in Ontario in the period before cannabis legalisation, the early period after legalisation, and after full commercialisation. And I'll briefly look at similar time series data from other Canadian provinces where appropriate. One of the clearest impacts of cannabis legalisation in Canada, and this has been also reported in the US, has been a big increase in childhood poisonings. This is young children who ingest the cannabis products intended for adults that might be left unattended in a house, and a child gets hold of them and consumes them, usually assuming that they're a confectionery or candy. And what, unsurprisingly, the big driver of this increase is the availability of cannabis in edible forms, such as the gummy bears that I showed you a photograph of earlier. Now, the plot here shows poisonings in the period before cannabis legalisation, when there were poisonings, but fairly low level. The early period of cannabis legalisation was when it was legal to purchase cannabis, but there were a relatively small number of stores available, so supply was still restricted. And the second period describes the second year of legalisation, when edible products became available for sale. And this is the data on the number of sales of these products. And as you can see, when these products did become available, we saw a big increase in the number of children attending emergency departments because of accidental poisoning of cannabis products, primarily edible products. This was all in the province of Ontario. In the next slide, the same group, Daniel Myron and colleagues, have looked at similar trends in these poisonings in Ontario, which is the orange line, Alberta and British Columbia, the green, and Quebec in blue. What's interesting about these three provinces is that Quebec has not allowed the sale of edible products, or didn't in this period. It's since relaxed that ban and is now proposing to allow their sale. But for the period of this study, there were no edible products legally available in Quebec. They were legally sold in these two provinces. So strong indication it's the availability of edible cannabis products that is responsible for the big increase in childhood poisonings. This is adult attendances for cannabis-related problems, often symptoms of intoxication or dependence. And we have two lines here. One, the line at the bottom is all adults. And so what we can see there is a modest increase. And what we see is the biggest increase in young adults and youth. So not much increase, a bit of an increase before legalization, leveling off in the early period when these products were not yet widely available, and a big increase again as legal stores opened and the commercialization became more widespread. We see very similar things for a novel phenomenon called cannabis hyperemesis syndrome, which is uncontrolled vomiting which occurs in people who are very heavy cannabis consumers. And what we can see here is a very similar pattern. This particular, it's a less common consequence, but it has increased since legalization and particularly since commercialization. More contentious or less certain impacts have been on emergency departments for traffic injuries. This was an early study in Ontario and Alberta covering the first year of legalization and emergency department presentations, suggesting, if we put a straight line through there, that there has not been much effect of legalization on numbers of people attending emergency departments because of traffic injuries. The same was true if we looked at youth in that particular time frame. But more recent data, and that from Ontario by Myron and colleagues, suggests that rates have increased. This is all traffic accidents with cannabis involvement, showing an increase over time through the 3 periods earlier enumerated. By comparison, alcohol is not shown. These are ED visits with alcohol involvement, traffic accidents. There has been some suggestion of increase, but it's less marked than has been the case with cannabis. And we've got motor vehicle occupant ED visits with cannabis involvement showing similar increase, whereas alcohol hasn't. And this is one for cannabis attributable hospitalizations in Ontario. And this is showing a very similar pattern, indicating that as legalization has occurred, and particularly wider spread commercialization and increased availability, we saw more people attending hospitals and emergency departments for cannabis-related problems. The particularly contentious issue was what impact legalization might have on presentation of psychoses, either cannabis-induced or the schizophrenia form of schizophrenia. This was early data from Ontario and Alberta, suggestive of an increase over time preceding legalization, but not any marked change in that trend post-legalization. But more recent data from Ontario, from Myron and colleagues, suggests that there has been a big increase here in psychoses where cannabis has been involved. Sorry, cannabis is the green, and methamphetamine is the orange. There's been a bigger increase in methamphetamine, which would be of interest to researchers in Japan as a more potent cause of psychosis, and that's the case in Canada as well. But we also see similar increase in psychoses attributable to cannabis. So an important question is how legalization has affected other drug use, and we're not really in a good position to give a confident answer to that question. An important issue is whether cannabis is a substitute for or a complement for cannabis use. If it's a substitute, then you might expect, if people use less alcohol after cannabis legalization, you might expect to see less alcohol-related harm. In the US, the evidence from sales and survey data are mixed. Some studies suggesting that alcohol sales have declined since legalization, others suggesting that people are more inclined to use cannabis and alcohol together in surveys. We know that the alcohol industry, particularly in Canada, is working to do whatever it can to make cannabis and alcohol complements, that is, things that can be used together. and the alcohol industry has been very active in producing and in marketing cannabis beverages that can be sold in, that they hope can be sold in bars and places where alcohol is consumed. Has legalization affected cannabis use? There was an early study shortly after cannabis legalization in the US, which suggested that medical cannabis use, the legalization of medical cannabis use reduced opioid overdose deaths in states which had done so. But this has not been supported by more recent analyses of trends in overdose deaths. To date, there's not a lot of evidence that cannabis legalization has had much of an impact on rates of tobacco use, but there has been some crossover in that cannabis and tobacco are both increasingly vaped by young adults in the US and in Canada. So I think it's important to recognise the limitations of the studies that I've briefly summarised. The great majority of research on the impacts of legalisation has focused on the impact on cannabis use in surveys, and most of these have been simple pre-post comparisons where researchers ask, has a health outcome changed since cannabis was legalised? And the more difficult question to answer is whether any change that has occurred can be attributed to legalisation per se, or might be attributable to other changes in policy or other events that have occurred since legalisation. And the major challenge is we lack good time series data for many health outcomes that are important to assess, and we don't have good comparable data from jurisdictions which have not legalised cannabis. And measures of these outcomes may well be affected by legalisation, particularly if people are more inclined to acknowledge cannabis use after legalisation because it's no longer illegal. We might be seeing more reports of cannabis use after legalisation than occurred before. And the additional complication, particularly in the case of Canada, is that the early years of legalisation there coincided with the COVID epidemic, which had impacts on the ability to sell and consume and purchase cannabis. So this is a provisional summary of trends. This is sort of my take, as it were, on what the evidence to date is of the impacts of cannabis legalisation. I think the clearest increase has been in daily cannabis use, more so in the US than Canada, but one would expect to see this sort of occurring more in the future as cannabis use becomes more socially acceptable and cannabis is more regularly available at a cheaper price in a more potent form. I think there's probably been an increase in symptoms of cannabis use disorders in the US, but it's not quite as clear-cut as it is for the increase in daily use. It is clear that childhood poisonings have increased in Canada, and I haven't cited the US data, but there is similar data from the US to that in Ontario, and it seems to be largely driven by increased availability of edible cannabis products that could be confused with candies by young children. The impact on cannabis-related car crashes is more conflicting, and there's challenges in distinguishing between evidence of recent use from cannabis impairment in road traffic accidents. And as I've mentioned, the impact of COVID post-legalisation muddies the waters, particularly in Canada. And there's also been increased testing for cannabis use amongst drivers, which means that it's more often detected post-legalisation. It is clear, I think, that more people are presenting to emergency departments for problems related to cannabis intoxication and symptoms of cannabis use disorders in Canada and the US. That's possibly increased to a degree by people being more willing to ask, well, medical staff being more willing to ask about and patients being more willing to report cannabis use. But I suspect there's a real increase there as well. In the case of psychoses and schizophrenia, I think the evidence is clearest in Ontario of an increase in treated prevalence. And this was probably occurring before adult legalisation because of liberally regulated medical cannabis programs in Canadian provinces. And there is a suggestion of further increases since commercialisation of cannabis sales. What's less certain is what's behind that relationship. Is heavy cannabis use a contributory cause of new cases that wouldn't have otherwise occurred? Or are we seeing heavier cannabis use increasing exacerbations of schizophrenia and producing more chronic cases amongst people with existing illnesses? That's to be teased out. There are some important caveats, I think, that need to be entered. There's an inclination to think, well, the impacts of legalisation to date have been relatively modest. Certainly advocates of legalisation argue that. But we're still in the very early days. It's only been 10 years, just over 10 years in the first two US states, Colorado and Washington state, to legalise. And most US states that have legalised since, we have much shorter periods of experience. We have 6 years of post-legalisation in Canada, and only 5 years with a full legalisation of extracts and edibles. And in both countries, retail cannabis markets are still developing, and there's quite a process of businesses struggling to survive because there's probably an oversupply of cannabis and cannabis retail outlets in both countries. There still remain major constraints on commercialisation. In the US, it's still federally prohibited. Cannabis is still federally prohibited, which has provided a major break on full legalisation there. Public health regulations in Canada have been introduced, but the industry is now lobbying heavily to remove restrictions on plain packaging, allow advertising and brand names, and to reduce rates of tax. So it will remain to be seen whether the restraints that we see now will continue. And as I've already indicated, there are major limitations in the evaluations of the impacts of legalisation to date in the heavy reliance on survey and health data and the lack of comparison data from jurisdictions that have not legalised. So that's all restricted our ability to make strong causal inferences. Some of the constraints on US commercialisation, I won't go into detail, but just they do make it much more difficult for people to legally sell, use banking services, and the additional complication is that businesses have to pay taxes under the American tax law, but they can't deduct the cost of doing business from their expenses. So there's a de facto federal tax that makes it difficult for cannabis businesses to operate in the US. And because of the federal prohibition, there's been restrictions on the ability of the finance industry, tobacco and alcohol industries to legally invest in cannabis in the US. That hasn't stopped them investing in Canadian cannabis businesses where there is a lot that's not a constraint. So what remains to be seen is if Congress removes federal cannabis prohibition. They haven't so far, and it's probably less likely to happen under a Trump administration than would have been the case under the Biden administration, where there was a proposal to reclassify cannabis to allow to remove it from federal cannabis prohibition, the current form. And if that were to happen, we'd expect to see even larger falls in prices and probably more use than we have seen to date. So just to summarise and leave plenty of time for questions, cannabis legalisation in the US has occurred since 2014, increasingly more common and now in the majority of US states. The regulatory model that's been adopted is that of alcohol, and that has given a lower priority to protecting health than it has to reducing illicit markets and raising tax revenue. But federal prohibition in the US still constrains commercialisation. Canada provides an interesting test case for a more public health-oriented approach to regulation that is under pressure from the cannabis industry at present, And with the likelihood of a change of government there later this year, we might expect to see some relaxation of the regulations that were put in place. Short-term adverse health effects have increased, as we'd expect, with increased daily use amongst adult users, and we've seen increased ED attendances, childhood poisonings, and possibly road crashes, although it's still up for debate. And it will take a lot longer to evaluate the effects of legalisation than we've so far seen. It would be unsurprising if harm were to increase with further liberalisation of markets, given everything we know about our experience with the history of alcohol and tobacco, and in some countries with gambling. So I'll finish there to allow plenty of time for questions.